mental health echo, we talk about, you know, mental health and wellness of, you know, our patients and how to best address those needs. One of these things that is sometimes overlooked is the mental health needs of the helping professionals, the caring staff, people who sometimes hear very difficult conversations and who are required to intervene with compassion multiple times a day with very difficult circumstances. I remember very well sometimes nurses would come to me just essentially decompress because they heard so many terrible things. We know that this life can sometimes be wonderful, but sometimes be difficult. So Belinda's presentation is going to be all about trauma and the helping professional. So thank you, Belinda, and welcome to all our guests. And Belinda, I'll turn it over to you. Oh, Belinda, don't forget.
Bear with us.
Belinda, you're muted. Don't forget. Same mistake I made.
Sorry about that. All right. Thank you for that introduction, Dr. Boyce. I was just saying that that introduction is very relevant and applicable because, of course, as helping professionals, we are exposed to trauma daily in many different ways. And so it is very important for us to be aware of what we are experiencing and how we can support each other and support ourselves. So Conrad, you could go ahead and share the screen.
Okay.
So we can get started.
Yes. Are you all seeing the screen? I think we are. Great.
Yeah. All right. So is everyone hearing me clearly? Are you hearing me clearly?
Yes, loud and clear.
Okay, nice. All right. So trauma and the helping professional. So I'll start with what is trauma. So trauma is an emotional response to an event that is deeply distressing. It can be triggered through a one-time or ongoing event. Conrad, you could change the slide. Yeah. Right. So I wanted to start with this because I think many of us think of trauma as something that is objective, like an objective experience, and it really isn't. Trauma is something that is subjective. So for example, many of us may experience a car accident together. We're in the same car and we get into an accident. However, my reaction to it may be different from yours. I may have ongoing reactions or symptoms related to that event that occurred, whereas you may be fine. You know, there's no emotional residue from that experience. And so I think the understanding of trauma as an emotional response, which is subjective and not necessarily something objective that has happened outside of us, is very important. So I wanted to clarify that. Moving on. So when a terrible event occurs, there are two things that happen. There's the immediate response and then there are longer term effects. So the immediate response is immediately after a terrible event occurs, persons may experience a state of shock or denial, right? So going back to that car accident, if I'm in a car accident, I may feel like, oh, I just have to do things, but I'm very detached from the experience. Nothing is really happening. I'm not crying. I'm not shaken by it at all, and that could be described as shock. Or I could feel like, no, that didn't happen to me. I can't believe that happened to me. Denial, right? And then longer term effects of a terrible event may include nightmares, unexplainable or unpredictable emotions, and even physical symptoms like headaches and nausea, which can suggest trauma. So those are more long-lasting effects from this terrible event that would have happened. Next is types of trauma. So Many times persons think of trauma, as I said, as this one objective, external thing that has happened, an event. However, now that we have established that trauma is a subjective internal experience, we can separate it into the different types of trauma. So there's direct trauma, where an individual is exposed to or is in close proximity to a terrible event which triggers a trauma response. For example, a paramedic would be a helping professional responding to a scene of a fatal car accident. And then there's indirect trauma. An individual becomes aware of the occurrence of a terrible event and it and its details after it has happened through conversation or media. So, for example, the paramedic explains in great detail to his co-worker the scene of the car accident. Therefore, the co-worker is exposed to indirect trauma. Next is vicarious trauma. So vicarious trauma is a form of indirect trauma, meaning that you're not in close proximity to the terrible event that would have occurred. You are aware of the details through some sort of medium. So vicarious trauma is a form of indirect trauma that is often experienced by, but not limited to, helping professionals. The experience of vicarious trauma leads to an alteration or a profound shift in an individual's worldview. The beliefs of an individual may be possibly damaged by repeated exposure to trauma-inducing material. The key characteristics to remember of vicarious trauma are: 1, it is cumulative, and 2, it has a long-lasting effects. So I have an example here. Sorry, excuse me. I can't move my LinkedIn. Here. Sorry about that. So, for example, Marie has been working as an investigator in the Child Protection Department of a community police station for the past 4 years. During her first 6 months on the job, she suffered with horrific nightmares related to cases she worked on and severe migraines. As she became more seasoned in the job, these symptoms disappeared. Marie has a 1-year-old daughter who she refuses to leave in the care of anyone, including her husband and father of the child. She only trusts her mother to care for the child, but calls constantly and demands to know the exact details of the child's whereabouts, etc. Her relationship with her mother and husband are now very strained, but Marie has difficulty in explaining why she behaves as she does. So I just want to sit with this example for a bit. And I want to encourage you all to maybe give it a second read. So this is Marie's experience as an investigator in Child Protection Department. At the beginning of her experience at the Child Protection Department, she had horrific nightmares, migraines, but that sort of went away. And then after she has her daughter, she has difficulty leaving her daughter with her dad and even with her mom, because she has to call her mom all the time to find out what's going on with the child, where she is she all right, but in a sort of obsessive way. So the next slide asks, what types of trauma would Marie have experienced at her job? When I say types of trauma, I'm talking about direct and indirect. So I don't know if anyone would want to respond and say what they think, or put it in a chat box. Or should I just continue on my own?
Can I volunteer?
Of course, thank you so much. Yes, Alana.
I know that it's definitely indirect.
Yes.
And then I was thinking about your definition of direct before. I know it didn't happen to her personally, but she was in a situation where she witnessed, I guess, firsthand
Right.
the else being happened to. So in that respect,
Right.
I don't want to say both or if to go with the indirect.
Yeah. So I would say both as well, because the definition of direct trauma is being in close proximity to a terrible event, right? So you're exposed to or you're in close proximity to this terrible event which would have occurred. So the example that I gave was a paramedic responding to the scene of a fatal car accident. Now the paramedic is not in the accident, he's just responding to it. But because he is in close proximity to and is directly exposed to the terrible event which would have occurred, he has been exposed to direct trauma. Yeah, and Marie would have found herself in similar situations, so direct trauma is applicable there. But then, as you rightfully said, also indirect trauma. So there may have been times where persons would have relayed the details of terrible events to her, which would have triggered a traumatic response, right? So Marie definitely experienced both direct and indirect. And the second question would be, do you think Marie experienced a change in her beliefs or worldview? So do you think her experiences would have impacted the way in which she viewed the world or her belief system regarding family and relationships, possibly trust? Dr. Boyce, I see you nodding your head. Yes. So, yes, so Marie would have had a shift in her worldview. And I don't know if you all remember those key characteristics of vicarious trauma. The key characteristics are that it is long-standing, it is cumulative over a period of time. She's been working in this department for 4 years, and it has a long-lasting effects. If your worldview has changed and your belief system has changed, that is a long-standing effect, unlike a migraine, which goes away. A belief system, once it is altered, it remains with you. And so it is evident in her behavior toward her husband and her mom that her belief system in terms of relationships and her worldview with regard to persons and how they take care of children, how they treat children, has been changed or altered, right? And it is now impairing her ability to engage with her husband and mom, and it will definitely impair her interaction with her own daughter as her daughter gets older. So many times we may find ourselves in situations where we are engaging in behavior that we cannot explain, which is what is happening to Marie. At the end of the example, it says her relationship with her mom and her husband are now strained, but Marie has difficulty explaining why she behaves as she does. So it's like an unexplainable thing, but she just does not trust people with her child at all. And it's difficult for her to connect that it is because she has been exposed to so much trauma, both direct and indirect, over a period of time, that her belief system has now changed. So a change in her belief system is not stark, is not something that happens like someone turning on and off a light switch. It is something that is subtle and it only becomes evident in behavior over a period of time. So moving on. I want to introduce two concepts, the first of which is compassion fatigue. So compassion fatigue is a profound and emotional, is the profound, I have a typo here, sorry. Compassion fatigue can be described as the profound emotional and physical exhaustion that helping professionals may feel as their career progresses. It can be characterized by an erosion of empathy and a loss of hope and compassion toward clients, colleagues, and self. The persistent influence of factors like system failure can lead to the feeling of compassion fatigue. Compassion fatigue is very common but not limited to helping professionals and can be just as impactful as vicarious trauma despite the differences. So the reason why I'm introducing this concept is I don't want it to be confused with trauma. So compassion fatigue is something that many persons experience, and it's not limited to, as I said, helping professionals. So persons who work in other fields but have interactions with persons in their day-to-day life can also experience compassion fatigue. So you just reach the point of emotional and physical exhaustion after a period of time. So for example, someone may come and tell you a very, very sad story about their life, and when they're telling you this, you don't have a reaction. You're like, oh, okay, cool. And you're just ready to do the intervention, write up their medication, get to the next task. So the compassion that you would have felt in the beginning of your career is no longer there. Or when you were first exposed to someone experiencing difficulty, you experience a great deal of compassion toward them. You really want to help them out. You really want to connect to them and ensure that they know that you empathize with them. However, when compassion fatigue is happening and present, that compassion is not there. So you're not disrespectful, and you're not bringing harm to the person. However, it may be difficult for you to feel that compassion toward them. It's almost like overstimulation and the concept of habituation. So when a stimulus, when you're exposed to certain stimuli, you experience a reaction. However, if there's repeated exposure to the stimuli, it becomes, the reaction goes away, right? So compassion fatigue is similar to that sort of experience. The next concept is something that comes up pretty often, which is burnout. So many times persons express burnout, that they're experiencing burnout, etc. So burnout can be described as the experience of mental, emotional, and physical exhaustion as a result of continuous exposure to stress. It negatively impacts your motivation and interest in tasks and can lead to you feeling hopeless. Burnout can also significantly impact your productivity, which is different from compassion fatigue, because compassion fatigue doesn't necessarily impact your productivity. It can, but burnout is something that can cause you to just stop doing the thing that is burning you out. And if interaction with clients and colleagues is burning you out, chances are you may stop. So next slide is signs and strategies. There are three general categories of signs of vicarious trauma and compassion fatigue that a helping professional should be aware of. The first category is physical, which is evidenced by exhaustion, headaches, increased susceptibility to illness, rashes, breakouts, insomnia, etc. Emotional category is irritability, cynicism, feelings of hopelessness, like what's the point of doing this, especially when there's systemic failure. You may feel like, why am I doing this? But I'll give an example of that afterwards. Feelings of resentment, intrusive thoughts, emotional insensitivity, detachment, etc. Then we have behavioral, increased use of drugs, so alcohol, intimacy issues, engaging in infrequent negative conversations, venting at the job, questioning competency, lowered attendance and punctuality, etc. So the example of someone feeling hopeless at the job may be, I experienced this at my previous job where I worked with the migrant community, and I really wanted to get them some help and connect them with resources that were available in Trinidad. And many times after the connection was done, the linkage, so I refer them to another agency. After you refer them to the agency, nothing happens, or they have to wait months for an intervention. They can't get support, and that's a system, that's an example of systemic failure. So there's no system in place to support these people that you're referring. And then you may feel like, why am I doing this? What is the point? Why am I meeting with these people? Why am I referring them? They're not going to get the help that they need anyway. So what is the point, right? So when you start to feel that sense of hopelessness, that is an evident, excuse me. So when you start to feel that sense of hopelessness, that is a sign that you are experiencing compassion fatigue or vicarious trauma or burnout. So the next slide is strategies. So these are two strategies that can be used to assist helping professionals when they're experiencing vicarious trauma, compassion fatigue, or burnout. The first is a warning system. This allows the helping professional to identify on a scale the degree to which they are experiencing symptoms and the identifiers. For example, on a scale of 1 to 10, with 10 being the worst I can feel about my work on clients, I'm at a 7. I know this because I'm wishing that my clients don't show up to their appointment and I feel so exhausted I can't work out. So within that example, I have identified the degree to which I feel poorly and what the identifiers are. My identifiers would be, I'm wishing that my clients don't show up and I am unable to work out because I don't have the physical capacity to do so. The second strategy would be a check-in system. This is helpful for employees when they have recognized that they need support. And a good example of that many organizations have is an employee assistance program, where an employee can reach out to an external agency and get support from another helping professional who is versed in the field of helping and is familiar with the symptoms of burnout and compassion fatigue, vicarious trauma, etc. So lastly, I just want to do a quick review of the 3 concepts that we discussed today. So the first is vicarious trauma. Vicarious trauma is the erosion of an individual's beliefs and worldview. This leads to a state of tension or preoccupation. It can be addressed through increased self-awareness and use of strategies that are available and easily accessible. The next would be compassion fatigue. Compassion fatigue is emotional and physical exhaustion evidenced in loss of hope, compassion, and empathy towards clients, colleagues, and self. Can be possibly addressed through adjustments in workload or shift in focus. And finally is burnout. Burnout can develop through a poor workplace experience, evidenced by long hours, unmanageable workload, poor relationships, and perception of fairness, etc. And it can be addressed through a job change or a significant break from the workplace. So I just want to bring your attention to the ways in which each of these concepts can be addressed. Vicarious trauma calls for increased self-awareness, and it calls for support in paying attention to that worldview and belief system that has been changed. It is difficult for an individual to be aware of their belief system and a worldview on their own. And so I definitely encourage an external source of support, whether it be a therapeutic intervention or something else, a mentor or something. And then compassion fatigue, it could be addressed through the adjustment of a workload or shift in focus. So when you feel that emotional and physical exhaustion from just being exposed to continuous stress, once you remove yourself from that situation or take a break from that situation, the compassion fatigue goes away. It's just like physical fatigue. Once you are rested, it goes away. Same with burnout that occurs within your workplace. If you change your place of employment, or if you take a significant break from work like a vacation, etc., then the burnout goes away. You feel a sense of rechargement, you feel recharged, and you're able to get back in and you're able to pay attention to the tasks that you would have been doing before you left. And so evidence here would be the significance of vicarious trauma, because it doesn't go away like how compassion fatigue and burnout goes away. If you feel like you need a break and you take a break from work and then you come back in and you still feel that sense of exhaustion your first day back, then it's not burnout you're experiencing, it's not compassion fatigue you're experiencing, it is something greater than that. And so your intervention for yourself should definitely be greater than taking a break. It should definitely be greater than shifting focus or doing an extra activity. There's a need that you should pay attention to, and it could be that you've been exposed to vicarious trauma and you need support in addressing the vulnerabilities that have been created by that exposure. So thank you very much. Do you have any questions or thoughts?
Hi. Thank you, Belinda. Yes, Alana, go ahead.
Hi, sorry, were you going to ask the question? I can ask after you.
I had seen you raise your hand during the presentation, so I was actually going to put on you. Yeah.
Oh, Yeah, I decided to relinquish that question. I was going to say, I mean, thank you very much for that presentation. It made me realize that I'm probably suffering with quite a number of those. But
As expected, as expected.
I was thinking about how we respond to news of crime as well. I think in my case, it probably has changed my worldview and beliefs. And probably quite a number of us have experienced that. I remember some time ago, a social worker at the hospital mentioned that how I had never thought about this. This was some years ago, before I knew about all of this. How they felt that they needed counseling as well, because the load of clients that they take on, by the end of the day, they just had to go detox. And I didn't know if there's anything in place in our public healthcare system that addresses that at all for social workers, psychologists, counselors, that sort of thing. I've never heard, anyone mentioning whether that's available or whether it's a policy for social workers to have that.
Yeah. So I do know that the Ministry of Education has an EAP program for their employees, which would be all teachers and their families, etc. So I'm assuming that the Ministry of Health has the same. I'm not sure. However, if the Ministry of Health does not have an EAP for their employees, which I think would be worrying, there are many other resources that persons could tap into. I usually refer persons to TTAP's website, which is the Trinidad and Tobago Association of Psychologists. They have a directory listing of all psychologists registered with them that have a private practice that they could easily access. And it definitely is recommended for helping professionals. The purpose of this presentation is awareness. I think that's the first point, the starting point, right? So once you are aware that you are exposed to these things, once you start to feel any sort of fatigue in any way, then you can tap back into, hey, I remember those three concepts, maybe it's this, maybe it's that, and these are the resources that I can turn to. I think when we work in a particular field, like social workers or nurses and doctors, when you work in a particular field for a significant period of time, you get used to being faced with difficult circumstances. You get accustomed to persons having a difficult life and probably difficult medical situations, etc. And so your reaction to it is somewhat innate. You've conditioned yourself to react it in a certain way. However, conditioning does not exempt you from experiencing vicarious trauma, compassion fatigue, or burnout. It happens because you are human. So conditioning just triggers the response. It's like training a dog to do something. If you do this, it's like Pavlov's dog. If you do this, the dog is going to do that. But it doesn't mean that the dog wanted to do it or that the dog is not having another thought process or emotional experience. I think dogs have all of these things, right? I mean, people may disagree with me, but I think dogs have emotions and thoughts and stuff. So my point is, conditioning doesn't exempt you from experiencing these other things, and so in my training, I am very aware of myself and my own experiences, and sometimes in some fields that part of the training is left out or is not emphasized upon. So at this point, we have to reintroduce the concepts of self-awareness to helping professionals so that they are aware, because when you're not aware of yourself, you could be bringing great harm to others and yourself, which we want to avoid. We need to take care of ourselves too. Anyone else? Thoughts, questions?
All right. Well, if anyone is having difficulty with the audio and video, you can always type your questions or comments into the chat box. And Belinda, I just want to thank you again for that excellent presentation. I think it's always a challenge in these high volume sites like ours with limited staff and limited resources, that we have to sort of always be mindful of the sort of psychological stress that the caregivers are under, and sort of put systems in place to make sure that we are taking care of the caregivers as well as the persons to be cared for. So thank you again for that.
My pleasure.
So